Well, hello, Plainfield. This is Mayor Adrian Mapp, and I want to take this opportunity once again to welcome each and every one of you to this live broadcast.
Hola Plainfield, soy el alcalde Adrián y quiero tomar esta oportunidad para darles la bienvenida a todos.
I am extremely concerned that there are still some in our city who have refused to adhere to the recommended protocols that are still taking this disease too lightly.
Me preocupa mucho que todavía hay algunos en nuestra ciudad que se hayan negado a adherirse a los protocolos recomendados y aún no toman en serio la enfermedad.
The protocols were put in place for a reason. They are not meant to stop they are meant to stop the spread of the COVID-19 virus.
Los protocolos se implementaron por una razón. Están diseñados a detener el avance del virus COVID-19.
Unfortunately, too many of our young people and some older adults still continue to gather in groups with a total disregard for their own safety and that of the public and their families.
Demasiados de nuestros jóvenes y algunos adultos mayores aún continúan reuniéndose en grupos con total desprecio por su propia seguridad y la seguridad del público.
In recent days, there has been lots of discussions about how to reopen the country. I think those discussions are a bit premature at this time, and it would be a very serious mistake if leaders across the nation were to hastily follow what the president is calling for and jeopardize the lives of millions of Americans.
En los últimos días ha habido mucha discusión sobre cómo reabrir el país. Creo que estas discusiones son un poco prematuras en este momento y será un grave error si los líderes de todo el país seguirían rápidamente con lo que el presidente está pidiendo y pongan en peligro la vida de millones de estadounidenses.
The worst thing that governors can do would be to open back up the country before we know for sure that we have a handle on this deadly virus.
Lo peor que pueden hacer los gobernadores es abrir de nuevo el país antes de saber con certeza que tenemos un control sobre este virus mortal.
So we ought not to rush to open the country when we know that there are hundreds of thousands of people walking around in every city USA who need to be tested, but who still don't have access to testing.
No debemos apresurarnos a abrir el país cuando sabemos que hay cientos de millones de personas caminando en la ciudad de Estados Unidos que necesitan hacerse una prueba, pero aún no tienen el acceso a una prueba.
In Plainfield, we have a large number of people who are crowded into our 6.2 square miles. And in some parts of our city, people are living in very close quarters. They are living as families, and we have to respect that.
En Plainfield tenemos una gran cantidad de personas que están juntas en nuestras 6.2 millas cuadradas y en algunas partes de nuestra ciudad la gente vive en lugares muy cercanos. Ellos viven con familia y tenemos que respetar eso.
However, because of the tiny quarters where some of our residents are living, and because it is the best that they can do, I cannot blame them simply because they are poor and cannot do better. That is their reality, and people ought not to be vilified simply because they are poor.
Sin embargo, debido a los pequeños barrios donde viven algunos de nuestros residentes y porque es lo mejor que pueden hacer, no puedo culparlos simplemente porque tengan bajos recursos y no pueden mejorarse. Esa es su realidad debido a sus condiciones de la vida difíciles y es probable.
However, we know that because of their tight living conditions, these individuals are likely to pass the virus on to family members, and that worsens the situation for all of us here in the city.
Es probable que estas personas transmiten el virus a los miembros de su familia y esto pueda empeorar la situación de nuestra ciudad.
And so we have been having conversations with the county for the past several days about opening a test site here in Plainfield.
Así que hemos estado conversando con el condado durante los últimos días sobre la apertura de un sitio de prueba aquí en Plainfield.
It really doesn't matter which ward or which section of the city this site is located in. What's more important than anything else is that there be a site here for testing in Plainfield where more of our residents can be tested.
No importa en qué barrio o en qué sección de la ciudad se encuentre el sitio, lo que es más importante que cualquier otra cosa es que haya un sitio aquí en Plainfield donde se pueda evaluar a más de nuestros residentes.
Now, why do I say that? As of last Friday, April 10th, only 59 people from Plainfield were tested at the site located at Kane University. Yet we have a high number of people that tested positive for the virus.
¿Por qué digo esto? Porque hasta el viernes pasado, viernes 10 de abril, solo 59 personas de Plainfield fueron evaluadas en la Universidad de Keene. Sin embargo, tenemos una gran cantidad de personas que dieron positivo para el virus.
So even though the site at Kane University is for all residents of Union County, the number of people being tested from Plainfield is very low.
Entonces, a pesar que el sitio de la Universidad de Keene es para todos los residentes de nuestra condada, el número de personas que hacen las pruebas ahí desde Plainfield es muy bajo.
It is not because people who wanted to be tested were refused testing. That is not the case at all. The problem is, in my mind, people from Plainfield are not going to Kane to be tested simply because they cannot get there.
No es porque la gente a quienes quieren hacerse la prueba se les negado la prueba. Ese no es el caso en absoluto. El problema es, en mi opinión, que las personas de Plainfield no van a Keene para hacerse la prueba simplemente porque no pueden llegar a ese sitio.
That site is located on the eastern end of the county, and Plainfield is on the opposite end.
Ese sitio está ubicado en el extremo de este condado y Plainfield está en el otro extremo opuesto.
It is not easy for people who don't have cars or who don't have any other kind of transportation to get from the western side of the county to the eastern tip where the site currently for testing is located.
No es fácil para las personas que no tienen carros y que no tienen transporte ni ningún tipo de transporte para que ellos puedan llegar del lado oeste del condado hasta el otro extremo de nuestro condado.
Now, clearly, if people did not have those mobility issues, I am confident that the number of people with Plainfield addresses who were tested at Kane University would have been much higher.
Ahora, sí, las personas que no tuvieron esos problemas de movilidad, yo estoy seguro que el número de personas con direcciones de Plainfield que fueran evaluadas en la Universidad de King hubiera sido mucho mayor.
I believe that there are people who are walking around our city who may be asymptomatic and who may be carrying the virus without even knowing that they have it. And because of that, the virus could easily be spread in our community.
Creo que hay personas caminando en nuestra ciudad que pueden ser asintomáticas al virus. Son portadores del virus y ni siquiera saben que lo tienen. Y por eso el virus está creciendo aún más en nuestra comunidad.
I am bothered by the fact that given our small size, that we had so many positive cases here in the city of Plainfield.
Me da molestia y tristeza que en nuestro condado y ciudad de Plainfield hayan tantos casos.
Our numbers are high. We have over 641 people that have tested positive for the virus, and an additional 753 are under quarantine as of today.
Nuestros números son altos. Tenemos más de 641 personas que dieron positivo para el virus y 753 adicionales que están en cuarentena.
Sadly, 15 of our residents have lost their lives to the virus, and that pains me to no end.
Lamentablemente, 15 de nuestros residentes han perdido la vida por el virus y eso a mí me duele sin fin.
These are people that we know who didn't have to die if our federal government had acted sooner.
Estas son todas las personas que conocemos que no tuvieron que morir si nuestro gobierno federal hubiera actuado antes.
I am very bothered by the fact, it really pains me that people who have lost loved ones are not able to give them the decent and dignified burials that they would otherwise have had under different circumstances.
Me lamenta mucho que por el hecho de las personas que han perdido seres queridos, no han podido tener entierros dignos si esto fuera en diferentes circunstancias.
You've heard governors from around the country, Governor Murphy, Como, Lamont, they have all said that now is not the time for us to let our guards down. Now is not the time for us to take our foot off the gas. We cannot relax.
Ustedes han escuchado que los gobernadores de todo el país, Murphy, Cuomo, Lamont, han dicho que ahora no es el momento de bajar la guardia. Ahora no es el momento de quitar el pie del acelerador.
So we must proceed with all haste to make sure that we provide testing to everyone in our city who needs to be tested and those who want to be tested.
Debemos proceder con toda prisa para asegurarnos que hay prueba para todos en la ciudad que necesitan pruebas y aquellos que también se quieran hacer la prueba.
It is the only way that we are going to take control over this virus and slow its spread across our city, state, and nation.
Es la única forma que vamos a tomar el control de este virus y retrasar su avance en nuestra ciudad, en el estado y en la nación.
If we are to reopen the country, there must be mass testing across the board.
Si vamos a reabrir el país, debe haber muchas pruebas en todo el país.
We must have an expedited testing for all of our citizens, and we must be able to determine whether or not a person is COVID-19 positive or whether he or she is asymptomatic.
Debemos tener una manera para acelerar las pruebas para que todos nuestros ciudadanos puedan determinar si una persona es positivo para el COVID-19 o si una persona es asintomática.
This is important to our cities and to our families.
Esto es muy importante para nuestra ciudad y para nuestras familias.
And although testing is not the only answer, it is a major part of the answer. But we know we still have to expedite a cure.
La prueba no es la única respuesta, es parte, pero es una parte importante de la respuesta. Pero sabemos que todavía tenemos que acelerar una cura.
So getting to a vaccine quickly and safely would enable us to treat people who have been infected by the virus in the same way that we now treat other diseases.
Tenemos que obtener una vacuna que nos permita tratar con las personas infectadas por el virus en la misma manera que ahora tratamos otras enfermedades.
So, a lot of work remains to be done.
Por lo tanto, aún queda mucho trabajo.
Now, many of you have asked about the racial composition of people in the city with the virus.
Ahora, muchos de ustedes han preguntado sobre la composición racial de las personas en la ciudad con el virus.
As you know, and as you have heard from other professionals and interest groups, and recently you heard our council president mention the fact that Black and brown people are disproportionately affected by the COVID-19 virus, and that is not because of a difference in hygienic behavior. It is not because of greater gatherings among Black and brown people. It is simply because of the disparities that exist within our healthcare system.
Como ustedes saben y como han escuchado de otros profesionales y grupos de intereses, y recientemente escuchado a nuestro presidente del Consejo mencionar el hecho que una de las personas afroamericanas, las personas afroamericanas son las más afectadas por el virus COVID-19. Eso no se debe a una diferencia en higiénico, eso no se debe a mayores reuniones entre personas afroamericanas, es simplemente debido a las disparidades que existen dentro de nuestro sistema de salud.
Disparities that exist across the board, disparities in our criminal justice system, disparities in every sector of our economy. It is because of systemic racism that we know Blacks and Latinos are denied the opportunities that others take for granted.
Las disparidades que existen en todos los ámbitos, lo que existe en nuestro sistema de justicia, que existe en nuestro sistema de economía y en todos los sectores de la economía, es debido al racismo sistemático, que sabemos que a los negros y a los latinos se les niega la oportunidad que les dan a otros por sentado.
We are denied medical care in ways that differ from other segments of the population.
Se nos niega la atención médica en formas que diferencian en otros segmentos de la población.
So there's no accident that Black and brown people suffer from higher rates of diabetes, higher rates of asthma, and higher rates of incarceration that leads to a greater propensity to be exposed as a result of being in close quarters.
Por lo tanto, no es accidental que las personas negras y latinas sufran más de diabetes y de otras enfermedades porque también están cercanos en lugares pequeños.
It is no accident that Black and brown folks are the cashiers, the ones that are cleaning the buildings in order for the wheels of our economy to keep turning. It is not by coincidence that we are the human machines that keep the economy going day in and day out.
No es accidente que estas son las personas que son los cajeros y las personas que esa comunidad depende y para que esta economía de nuestro país pueda seguir a flote.
It is because of the systemic built-in factors and inequities that we are the ones affected in greater numbers than the rest of the population.
Es por estas verdades que nosotros somos las personas más afectadas en el país.
For example, blacks are 13% of the population, yet we are 40% of the people who have died from COVID-19.
Por ejemplo, los afroamericanos son el 13% de la población, pero son el 40% de las personas que han muerto por el virus COVID-19.
This is something that our political leaders, our social justice organizations, healthcare professionals, and everyone who cares about social, economic, political, and healthcare justice must fight for.
Esto es algo por lo que nuestros líderes políticos, nuestras organizaciones de justicia social, profesionales de la salud y todos los que se preocupan por la justicia social, económica y política deben luchar.
The system is broken. There can be no denying that, and it must be fixed.
El sistema está roto y nadie lo puede negar y necesita ser reparado.
We are entitled to the same inalienable rights, chief among them being the right to life, liberty, and the pursuit of happiness.
Todos tenemos derecho a los mismos derechos que no se nos puede ser quitados, entre ellos el derecho a la libertad, a la vida y la búsqueda de la felicidad.
And so, as I speak to you this evening, I must emphasize these disturbing numbers that we have in our city.
Mientras te hablo esta noche, debo compartir tristemente contigo esto.
Again, I sadly share with you that the number of positive cases in Plainfield has risen to 641, and the number of deaths stands at 15, with an additional 753 of people who remain under quarantine at this time.
Tristemente, en Plainfield ha aumentado los casos positivos del COVID-19 a 641 y el número de muertes es de 15 con un adicional de 753 personas que permanecen en cuarentena.
Of the 15 deaths, 4 are Black and 4 are Latinos, and the race of the other 7 has not yet been determined.
De las 15 muertes, 4 son afroamericanos y 4 son latinos, y la raza de los 7 aún no se ha determinado.
We know that 52 individuals at nursing homes and other long-term care facilities have tested positive for the virus, and that there were 7 deaths at those facilities.
Sabemos que 52 personas en hogares de ancianos y otros centros de atención a largo plazo han dado positivo por el virus y que han habido 7 muertes en estos centros.
Now, I know that many of you may know of people who have passed since these numbers were reported, but we can only report numbers that are official and that come from the CDC and the New Jersey Department of Health.
Yo sé que quizás algunos conocen personas aún más que han fallecido por este virus, pero nosotros solo les podemos dar los datos que están confirmados por la organización.
And
Del
I know that
CDC.
one of the challenges that we face is getting the demographic data that you've been asking for.
Y
It is
sé-
not because we don't want to give you this information. It is because it is difficult to come by and we just don't have it to the extent that you would like us to have it.
Uno de los desafíos que enfrentamos es obtener la información que ustedes están solicitando. No es porque no queremos dárselo, es porque es difícil de encontrar y simplemente no tenemos toda esa información.
But I want you to
África.
know that we are doing the very best that we can with the limited resources that we have in order to keep all of you safe and informed.
Pero quiero que sepan que estamos haciendo lo mejor que podemos con los recursos limitados que tenemos para mantenernos a todos seguros.
I remain very, very concerned about the fact that too many of our residents and businesses are going to be experiencing challenges as a result of the economic hardship that will be left in the wake of the COVID-19 pandemic.
Sigo muy preocupado por el hecho que muchos de nuestros residentes y empresas van a experimentar desafíos como resultado de las dificultades económicas que quedaron a raíz de la pandemia del COVID-19.
So much so that I have been moved to create a Plainfield COVID-19 Relief Fund. The purpose of this fund is to assemble financial resources for distribution amongst the most challenged in our city.
Tanto es así que me ha conmovido a crear un fondo de ayuda para Plainfield, y el propósito de este fondo es reunir recursos financieros para su distribución entre los más desafiados en nuestra ciudad por el virus.
We want to be able to help the small business person, the unemployed, the homeless. We want to be able to help every person who isn't in a position to help him or herself.
Queremos poder ayudar a la persona de la pequeña empresa, los desempleados y las personas sin hogar. Queremos poder ayudar a todas las personas que no están en condiciones para poder ayudarse a ellas mismas.
Some of our residents and business owners have found themselves in a very difficult situation through no fault of their own. And I will do everything possible to provide them with some of the level of relief to which they are seeking and to which they deserve, quite frankly.
Algunos de nuestros residentes y dueños de negocios se han encontrado en una situación muy difícil por causas ajenas a su voluntad y haré todo lo posible para brindarles algún nivel de alivio que ellos se merecen.
Hence, the reason we have created the Plainfield COVID-19 Relief Fund. It is out of sheer compassion and concern for our residents that I have been driven to create this fund.
De ahí viene el fondo que creamos para Plainfield, para la ayuda del COVID-19. Es conmovido por compasión, por preocupación por nuestros residentes que me han impulsado a crear este fondo.
A solicitation letter went out yesterday to a number of individuals and businesses appealing for donations ranging from $5,000 to $50,000 or anything greater for those people or companies that are able to give a larger sum.
Ayer se envió una carta de solicitud a varias personas y empresas que solicitaban donaciones que van desde $5,000 a $50,000 o algo mayor para aquellas personas o empresas que puedan dar una suma mayor.
However, we will accept donations of any amount. No donation is too big or too small. We want people and businesses to give according to their means.
Sin embargo, aceptaremos donaciones de cualquier cantidad. Ninguna donación es demasiado grande o demasiado pequeña. Queremos que las personas y las empresas den de acuerdo a sus medios.
There are many foundations in Plainfield and in the state of New Jersey who have the capacity to give in substantial and meaningful ways to this fund. Checks are to be made payable to the Plainfield COVID-19 Relief Fund. All of the donations will be dispersed to those individuals and businesses who are in need.
Hay muchas fundaciones en Plainfield y en el estado de New Jersey que tienen la capacidad de repartir de manera sustancial y significativa a este fondo. Los cheques deben hacerse al nombre del Plainfield COVID-19 Relief Fund. Todas las donaciones se van a repartir a aquellas personas y empresas que más lo necesitan.
So those of you who are listening and you know of individuals and or organizations who might be in a position to contribute to this fund, please send us that information.
Entonces, aquellos que están escuchando y saben de negocios o personas que están en la posición de poder ayudar esta organización para ayudar a aquellos más afectados en Plainfield, nos hacen saber.
Again, we want people to know that we have been working on a test site here in Plainfield. Once we started those conversations with the county, we put an appeal out for clinicians who are active or retired and are available to volunteer to come forward so that we will be able to staff the test site right here in Plainfield.
Una vez más, queremos que las personas sepan que hemos estado trabajando en un sitio de prueba aquí en Plainfield. Una vez que comenzamos estas conversaciones con el condado, hicimos el llamado a los médicos que están activos o retirados, que están disponibles a ofrecerse como voluntarios para aquellos que lo necesitan. Y esto podría hacerse aquí, una cita de prueba aquí en Plainfield.
In the meantime, I want you to join me in continuing to keep our guard up. Keep our foot on the accelerator as we continue to race full speed ahead towards flattening the curve and restoring normalcy to our city.
Así que únanse conmigo para continuar manteniendo la guardia en alta, mantener el pie en el acelerador mientras continuamos corriendo a toda velocidad para planear la curva y restaurar la normalidad en nuestra ciudad.
For us to do that and for us to protect our city and families, we must continue to practice social distancing, and we must stay home. We must stay home.
Para que podamos hacer eso, es importante proteger nuestra ciudad y nuestras familias. Debemos continuar practicando el distanciamiento social y debemos quedarnos en casa. Debemos quedarnos en casa.
The only time you should go out is to purchase food, pick up a prescription from your pharmacy, or to go to work if you are an essential worker. And if you must go out, you should wear a mask or some other face covering at all times.
La única razón por la cual usted debe salir es por si usted va a salir para comprar comida, recoger medicina o ir a trabajar si su trabajo es esencial. Y si sale, tiene que ponerse la protección como la máscara y los guantes.
There are no other reasons for you to go outdoors, so stay home and let us together flatten the COVID-19 curve so that the city, the country, the state, and the nation can get back to doing the people's business in an atmosphere of normalcy. Thank you, and may God bless you, and soon we will begin to see this curve flattening and take our city to a better place.
No hay otras razones para que salgas al aire libre. Así que quédate en casa y juntos trabajemos para planear la curva del COVID-19 para que nuestra ciudad, el condado, el estado y la nación puedan volver a hacer negocios de la gente en una atmósfera de normalidad. Muchas gracias, que Dios te bendiga y juntos trabajemos juntos para aplanar la curva del COVID-19.
As you can see, we have a number of people from our administration, and we're going to begin to take your questions, and we will do our best to answer all of them. But please know that this live chat is limited to the COVID-19, and we will not be taking other questions other than COVID-19 related. Let's hear the first question.
Bueno, como saben, aquí está mi equipo del consulado y vamos a tomar preguntas específicamente direccionadas al COVID-19.
Yes, Mayor. Hi, this is Jazz. This question came in earlier to the communications inbox. It's from Taylor. The question is, what is causing the daily increase in Plainfield COVID-19 cases compared to other towns? And the communication of urgency to shelter in place has not changed. The issue seems to be a bit more complex in nature. Is consideration being given to a multifaceted solution to decrease COVID-19 cases?
So that's a long question, and our Spanish translator will translate it, and then I will ask for portions of the question to be repeated.
La pregunta es, ¿qué está causando que el COVID-19 incremente diariamente y el protocolo de quedarnos en casa no está siendo implementado al 100%? ¿Hay acciones que vamos a hacer para mejorar esto?
Repeat the first part of the question, please.
What is causing the daily increase in Plainfield COVID-19 cases compared to other towns?
First, I must tell you that the increase in the number of cases in Plainfield is not unlike increases in numbers in other parts of the county or in other parts of the state. It is simply a factor of transparency, and we are reporting our numbers on a daily basis.
Bueno, primeramente lo que yo les quiero decir es que el incremento de número de casos en Plainfield no quiere decir que no está incrementando en otros condados y otros pueblos. Es simplemente un hecho de nuestra honestidad que les estamos diciendo los números cuando los recibimos.
What's part two of the question?
The communication of urgency to shelter in place has not changed. The issue seems to be a bit more complex in nature. Is consideration being given to a multifaceted solution to decrease COVID-19 cases?
Well, I must tell you that we continue to beat the drum each and every day. to get people to adhere to the social distancing, the hygienic protocols, and all of the recommendations that have been made. We have our first responders out on a daily basis, namely our police officers, and to some extent our firefighters, who are sounding the alarm bells across our city, asking our residents to stay home.
Bueno, lo primero es que estamos trabajando para ir reforzando el distanciamiento social. También la importancia de estar higiénicos y también todos los doctores y las personas trabajando en primera línea están trabajando, la policía y los bomberos, para asegurarse que las personas se están manteniendo en casa y diciéndoles que se queden en casa.
But what we're going to be doing differently is that we will be bringing a test site here to Plainfield, because we want to know what the real numbers are. And I know that some of you hate, just as I do, seeing these numbers grow on a daily basis. But I think we would be better off as a community if we were to get the facts and if we were to know the true gravity of the situation as it exists here in Plainfield. And that is why we're going to be bringing a test site to the city of Plainfield between Saturday and this coming Monday.
Por eso es que vamos a traer un sitio de prueba en Plainfield, y sé que no nos gusta ver que los números crezcan y muchas veces no nos gusta la realidad, pero realmente esto nos va a hacer mejor porque vamos a saber realmente los datos, y por eso es que vamos a traer un campo de pruebas y estamos trabajando para que eso se haga el sábado.
Let's go to the next question.
La siguiente pregunta.
We can't hear you, Jane.
Jen, are you muted? Okay, while we wait for Jen to unmute, Diana Ludibet says, good afternoon, Mayor. I have a question. After the COVID-19, what is the protocol? I have a friend that went to MedEmerge and the doctor told him he was possibly COVID-19. He's for more than 10 days in the home feeling terrible because the hospital refuses to treat him. How will he know the virus is gone from his system?
Buenas tardes. Mi pregunta es, después del COVID-19, ¿qué va a ser el protocolo? Yo tuve un amigo que fue aprobado positivo por el COVID-19, y cómo él va a regresar a la normalidad y cómo él va a saber que ya es seguro para que él vuelva a la normalidad.
Shep, would you be able to weigh in on that concern, that question? Just unmute your phone.
Hi, thank you. Okay, can you hear me? Thank you, Mayor.
Yeah.
I probably would need more details from the individual, but normally they would be told by their physician to stay at home for up to 14 days.
Bueno, yo necesitaría más información a ese caso individuo, pero normalmente se les he dicho que se queden en casa por 14 días.
And I will add that, yes, Shep, go ahead.
Okay, ahead.
Shep?
No, I'm waiting for you, Mayor. Please go ahead.
Oh, and I will add that we're going to do all that we can to follow up to the extent possible with individuals who have been tested positive. The contact tracing, we will pay very close attention to that so that we can get our arms around as many people who have been touched by this virus as possible, in order that we don't have repeat cases or numbers when the curve begins to flatten. We don't want to see it rising again. So our health department will pay very close attention to this pandemic, even after our country reopens, we will not be ignoring signs that ought to be indications of there being an issue.
Bueno, no podemos, vamos a tratar de proceder al contacto de cada persona y para que los casos no se repitan. También nuestro departamento de salud está tomando esto muy en serio para que cuando ya haya un plano, para que no vuelva a crecer los casos y asegurarse que las personas están seguras.
Let's go to the next question.
La siguiente pregunta.
We still can't hear you, Jen.
Can we unmute Jen, please?
Let's go to the next,
Okay.
Jazz.
Can you hear me? So this is more of a comment, Mayor. This is from Ricky Sipek. I apologize if I mispronounced your last name. He said people are not taking this seriously. People are getting haircuts, nails done by having people go to their homes for these services. He's seen it in other city forums and groups, and people are still working even if they feel sick. It's just not being taken seriously.
Esto es un comentario y dice las personas no están tomando esto en serio. Hay personas que todavía están trabajando y también se están haciendo las uñas cuando las personas vienen a las casas y también se están cortando el pelo y haciendo cosas que no deben de hacer en esta cuarentena.
Unfortunately, some people think that they're invincible. Unfortunately, some people don't realize the harm that they're doing to themselves when they expose their families as a result of not practicing social distancing.
Tristemente,
And everyone is experiencing hardships at this time, but we should not allow those hardships to cause us to put the health and well-being of our families at risk.
Tristemente, algunas personas piensan que son invencibles y que nada les va a pasar, pero estas personas no saben que no solo están poniendo a riesgo la vida de ellos, sino la vida de sus familias. Entonces es importante que tomemos esto en serio para no arriesgar a más personas.
I'd like to ask our police director, Burgess, to weigh in if there's anything that she could add to address the notion that people are still doing cutting hair and having their homes used as salons. What can we do? Is there anything that we can do?
Le quiero preguntar al director de la policía qué podemos hacer para estas personas que no lo están tomando en serio y haciendo cortes en la casa, etcétera.
Yes, sir. If that's the situation that someone is aware of, where that may be going on, then they can give the police department a call and give us that information. We are going around to businesses and making sure that they are adhering to the executive order by the governor. It's a bit harder to do that from someone's home, but whatever information that you can share with us, we will make an attempt to look into that.
Sí, bueno, si ustedes saben de la información de dónde esto está ocurriendo, de las casas o las personas, nos pueden llamar al departamento de la policía y nosotros nos encargaremos de esto. Es un poquito difícil cuando se trata de las casas, pero nos vamos a poner al tanto también para poner aún más, en más serio lo que el gobernador dijo, para poner eso en orden y que todos estemos siguiendo las reglas.
I want to get to some of the Spanish questions, so let's see if we can hear Jen.
Can you hear me?
Yes, you're coming through loud and clear.
Okay, great. So there haven't been any Spanish questions yet, but Jennifer Popper asks, have you received any volunteers to date for the testing site?
Jennifer pregunta si has recibido voluntarios para el sitio de examen que vamos a poner en Plainfield.
Yes, I am pleased to report to you that we've had a very good response to the call that we put out for volunteers. So we have a number of clinicians, which include doctors, nurses, EMTs, both active and retired. And so our call for volunteers has been very successful, and I am sure that the list will grow. So we're very pleased.
Sí, me complace informarles que tuvimos una muy buena respuesta de enfermeros, de enfermeras, enfermeros, de médicos, de EMTs, tanto activos como no activos, y sé que la lista va a seguir creciendo.
Okay, let's go to the next question.
La siguiente pregunta.
Rose Williams, the question and the comment. He says there's a lot of homelessness in Plainfield that plays a big part because they're all over, they're touching everything. The suggestion is, why don't you power wash the streets, the house, apartment complexes with bleach, all the stores downtown, power wash them. It might make a big difference because the landlords aren't doing it.
La pregunta es, hay muchas personas sin hogar que quizás puedan tener el virus. ¿Por qué no podemos lavar el fondo de las calles y lavar las calles? Y yo pienso que esto podrá hacer una gran diferencia para no seguir contaminando más personas y que la ciudad esté más limpia.
We have been fortunate so far that we've had a lot of rain. So nature has taken its course and has been helping us in terms of keeping our streets and open areas clean. However, I must add that we have also been using our fire department as well as our Department of Public Works to sanitize a number of public areas, especially our bus stops where people have to congregate in order to get on the bus. We've also been sanitizing our public benches as well as our 2 train stations. And so we have done some sanitizing of a number of public spaces across the city. But at this time, we don't have a plan to go down every street, Plainfield, and spray them with any kind of sanitizing materials. But we will also be following up with the businesses to get them to do what they must.
Bueno, estamos muy afortunados que en este tiempo ha habido mucha lluvia y esto nos ha estado ayudando. Sin embargo, hemos estado utilizando nuestro departamento de salud, de bomberos, para santificar como paradas de buses. También hemos desinfectado baños públicos, bancos públicos y estaciones de trenes. Ahora no tenemos un plan de ir en todas las calles, pero sí hemos estado haciendo nuestra parte de poder desinfectar los baños públicos, las paradas de tren, pero también vamos a hablar con aquellos negocios y dueños de negocios que ellos también hagan su parte.
Let's go to the next.
This question is from Maisha Brown. Are the police enforcing the lockdown? If so, how?
La pregunta es de Malaysia y la pregunta es, ¿la policía está reforzando el quedarse en casa? Y si sí, ¿cómo lo están reforzando?
I will take this opportunity to punt that question to our Police Director Burgess.
Yes, the police department is doing enforcement based on going out and getting that information out to the public about the stay-at-home order by the governor. We're going to continue to reinforce that information to the community If at any time that we have to continue to multiply get the information out to the same individuals and can confirm that they're not out for an essential purpose, then we can get what we need to be able to issue summonses to the public. We're trying not to have to go that far because we would like the citizens to comply because this is for their health and welfare. So we want to continue to put the robocalls out, the PSA out through our intercom systems, as well as we're passing out flyers so everyone can get that information and understand that this is for their benefit. So if any citizens, if you do see individuals out there and they're just congregating, please give the police department a call. We will come out and we will move them along. And this is something we have to do and work together at, that we can't, the police department is not going to know where everyone is at all times, but we will do everything that we can. But again, we would like for people to adhere to the order and not have to issue tickets, which would be costly to the public. Like, this is a time that, finances for everyone is difficult. So that would just be an additional burden on them. And we would hope that we wouldn't have to get to that point.
Sí, nosotros estamos haciendo nuestra parte en que estamos dando y reforzando lo que el gobernador ha dicho, y además de eso también estamos dando por flyers, por medio de nuestros mensajes, que la gente debe y queremos que la gente haga caso para que no tengamos que poner tickets, y si hay personas que sabemos que están afuera y no hay un caso razonable por lo que estén afuera, entonces sí vamos a poner tickets, pero no queremos llegar a ese instante, a ese momento. Entonces por ahora lo que estamos haciendo es reforzando lo que el gobernador ha dicho por nuestros mensajes y flyers y cosas adicionales, pero es importante que todos trabajemos juntos.
And don't be surprised if in the coming days you see drones flying overhead, reinforcing the stay-at-home message and encouraging people to practice proper hygienic behavior, wear face masks, and all of the things that we know have helped to make a difference in staying the spread of this virus. So drones may be coming.
Bueno, entonces no se pongan afligidos si ven drones volando alrededor de la ciudad, que eso les va a dar un mensaje, esos drones les va a dar un mensaje que todos estén limpios, que todos estén sanitarios, y para reforzar el mensaje de practicar la higiene y usar las mascarillas y las debidas usadas para podernos proteger de este virus.
Let's go to the next question.
Okay. Michelle Ulala Bryant Judkins says, I'm concerned about someone who tested positive and followed quarantine policy, then by chance after 30 days was tested again, came back positive. It never went anywhere. What if this person went back into population? This is a major issue. How many have returned to the community and are still positive?
I think you should repeat that question so that we get a clear understanding, a clear picture of what it is saying before we get the translation.
So apparently this person was tested positive. They followed the quarantine policy, and then after 30 days was tested again and came back positive again. They said it never went anywhere. What if this person went back into population? This is a major issue. How many have returned to the community and are still positive? In other words, the virus didn't leave her system, I assume is what they're saying.
Okay, let's get a translation first.
Ok, entonces primeramente esta persona fue probada positiva y hizo la cuarentena, y después de 30 días volvió a probar, se volvió a probar el examen y fue positiva. ¿Cómo esta persona pueda regresar otra vez a la sociedad y cómo eso nos afectaría a todos los demás?
Well, I'm going to ask Director Brown to weigh in on this issue, but I must say before he gets to weigh in, what I just heard is a situation that might be ripe for a case study by our health professionals at the state and federal levels, because some of us were led to believe that if you had the virus and that you go through the quarantine period, that you're not likely to get the virus again. So I am not somewhat, I am very concerned about what I am hearing. And I think this deserves a lot of follow up on the part of the city, our health department, as well as people at the state and at the CDC. Director Brown.
Thank you, Mayor. So one of the things that we have discovered with this virus is that there's a lot that we simply do not know. And some of it is around how people are tested positive the first time. They quarantine and they come out of quarantine and they are tested positive again. While this is not the norm, there have been situations and cases of this happening. The recommendation again is that they remain in quarantine. I please by all means call the Department of Health if this person is a plainfielder, and we will look into the situation. We probably already know. But indeed, these are limited situations where people do test positive the second time.
Hay muchas cosas que aún no sabemos de este virus y algo que también vemos que no lo vemos tan a menudo, pero sí lo vemos, es cuando las personas son también positivas después de la cuarentena. Eso no es la norma, no es lo normal, pero recomendamos todavía estar en cuarentena y quedarse en casa. Estos casos no son tan a menudo, son más limitados, pero si saben de algunas personas en Plainfield, nos dejan saber, quizás ya sabemos, pero sí, no es lo normal, pero sí hay casos así, recomendamos quedarse en casa.
Thank you for that. Let's go to the next.
Okay, this question is from a Spanish-speaking resident, Milton Santa Maria. Where can we do the COVID test and what will be the cost?
La pregunta es, ¿dónde podamos hacer el examen del COVID-19 y cuánto será el precio?
Currently, if you are a Union County resident, you can be tested at the only test site that is in Union County as of this moment in time, and that is at Kane University on Morris Avenue. There is no cost, zero cost to be tested. It is free of charge. I will follow up shortly after the first initial translation.
Primeramente, hay un lugar donde tú puedes hacer el examen en nuestro condado y es en la Universidad de Keene. Allí no hay precio, no tienes que pagar y está en la Universidad de Keene.
As I mentioned at different points during my opening remarks, we are working on bringing a test site to Plainfield, and that will happen. The question is, will it happen as early as Saturday as we first announced, or might it be delayed by a day or two? But there will be a test site here in Plainfield for the convenience of Plainfield residents, especially those who are not able to get to Kane University. And more importantly, this test site that will come to Plainfield will be a walk-up test site. You will not have to use your car. It will be a walk-up test site.
Bueno, lo más importante también es que estamos trabajando para que haya un sitio donde los residentes se puedan hacer el examen aquí en Plainfield. Lo estamos trabajando para que sea lo más antes posible, como el sábado. Quizás se demore 2 días más, aún no lo sabemos, pero estamos trabajando que esto se haga en Plainfield. Lo importante es que no va a haber no vas a tener que manejar, se va a poder hacer el examen si estás caminando y estamos trabajando para hacer esto en Plainfield.
Let's go to the next.
Robin Bright asked, will the county be providing any of the funding for the Plainfield test site?
Robin pregunta si el condado va a proveer los recursos para este sitio de hacer las pruebas.
The county will be picking up almost 100% of the costs of testing at the site that will be in Plainfield. However, there will be a cost to Plainfield, and the cost to Plainfield will be the use of our police officers to help with traffic control, crowd control, as well as some of our personnel who will be at the site. For example, our OEM and coordinator will be present. Any number of us will be present there. And so that's the only kind of cost we are looking at right now. But the county will fund the operation of the test site that will be in Plainfield. And we are very fortunate, very blessed to have some 17 clinicians that have so far volunteered their time to staff this test site.
Sí les quiero confirmar que el condado sí dará casi el 100% para poner este sitio de pruebas en Plainfield y también sí va a haber un costo. El costo será para cubrir el control de personas, el control de tráfico, aquellos trabajando como médicos, policía, enfermeros, bomberos y ya hay casi 17 enfermeros que están dispuestos a ayudar para que este lugar de pruebas en Plainfield se haga una realidad.
Let's go to the next question.
This question is from a Spanish-speaking resident. How will the city support people without job after the 30 days so they can cover their leasing, light, rent, etc.?
La pregunta es cómo la ciudad va a apoyar a las personas sin trabajo después de esos 30 días, como gastos de diversos gastos, cómo la ciudad los va a ayudar.
First, I must say that with or without this crisis that we're facing, our Plainfield Action Services does have a limited amount of funds that we provide assistance to people that are really in need, such as paying an electric bill or some short-term relocation situation. So I would recommend first calling the Plainfield Action Services to find out if there are any resources presently available that could help in desperate situations. But more than that, and what I have announced in this live chat, is that we have created the Plainfield COVID-19 Relief Fund. And the purpose of that is to assemble resources, financial resources in particular. We are accepting donations of material goods as well. PPEs, face masks and gloves and things of that nature. But our primary focus right now with this Plainfield COVID-19 Relief Fund is to collect significant sums of money by way of donations to be able to provide some financial and economic relief to the people of Plainfield and some of our small businesses that will have a very difficult time staying on top of their bills or keeping their doors open. So that's what we've done. We've created a Plainfield COVID-19 Relief Fund.
Bueno, conocen los servicios de acción de lo que está sucediendo. Nosotros tenemos un servicios de acción de campo, pero son limitados. Son como casos para personas que no pueden pagar la electricidad, personas que están pasando por reubicación. Y si usted es una de estas personas, puede llamar a los servicios de campo de Plainfield que les pueden ayudar. Y aún más que eso, nosotros hemos creado el fondo para ayudar a las personas que están afectados por el COVID-19. El propósito de este fondo es establecer recursos financieros, también físicos como mascarillas, guantes, pero más que eso físicos. Y queremos colectar dinero, queremos colectar recursos para ayudar a aquellas personas más afectadas y aquellos que están pasando por un tiempo muy difícil.
Let's go to the next question.
Okay,
So,
Cynthia
Mayor, you
Nunez?
already
Okay, repeat that, Jazz.
sorry. You already addressed a part of this when you they're asking if there's a fee associated with getting tested at the Plainfield site. You addressed that. There's a part 2 from Sam Cooper which says, "Is there any criteria for getting tested that you can share at this time?" But I also want to piggyback on that. A number of people, instead of asking them individually, are asking if you're able to share potentially where the site might be located. So that's a 2-part question.
La pregunta
one-
es si... Oh, sorry.
Sorry, Kathy.
No, you're good. Don't worry.
The first part is there any criteria for getting tested that you can share at this time? Second part is, where is the site likely to be located, if you can share right now?
Ok, la pregunta es si hay requisitos para uno poderse hacer el examen, es la primera pregunta. Y la segunda pregunta es si nos puedes dar la ubicación donde posiblemente estará este lugar de prueba para hacerse la prueba para el COVID-19.
I will ask Shep to address the criteria for testing, and I will address the other part.
Okay, so the criteria is the same as that you would find at Keene or any of the other testing sites. What will probably be happening is that you will call a telemedicine line to get assessed by a medical practitioner first.
Son los mismos requisitos que serían otro lugar y sería que, bueno, primero tienes que llamar el número y después ellos te dan el examen.
In terms of
And
part 2 of the
once-
question, yeah, Shep. I'll continue, Shep.
Okay,
Shep,
and
continue.
once you have been assessed that you meet the criteria, then you will be given an appointment to begin the process of testing.
Entonces, cuando tú llamas el número y ellos van a tomar un examen, a ver si realmente, no un examen, pero ellos van a ver si tú tienes los requisitos o lo que necesitas para hacerte el examen. Y si tienes los síntomas, entonces sí te puedan dar el examen.
Regarding the location of the test site, we have not settled on the exact location as of right now. It could be in one of 3 or so places. It could be at the Plainfield High School. It could be at our 4th Street parking lot, the parking lot that's owned by the city of Plainfield, which is across from the car wash there on Park Avenue on 4th Street when you turn onto 4th from Park. It could be at the Plainfield Health Center, or it could be a mobile unit that is stationed at Park Madison. We do not know the exact location at this time. That is still being worked out.
Todavía no sabemos el lugar exacto donde se va a hacer ese sitio, pero hay cuatro posibilidades. La primera es la escuela de Plainfield, el High School de Plainfield. La segunda es el estacionamiento en la calle Cuarta, frente al lugar donde se lavan los carros. Otra posibilidad es es el parqueo de centro de salud, y la otra opción es que pueda ser en una manera movible.
But we are working on getting it located centrally to most of our residents so that people could easily walk from any corner of the city to the location.
Pero estamos trabajando para que sea un lugar céntrico, para que la mayoría de nuestros residentes puedan caminar al lugar si necesitan hacerse el examen.
Let's move to the next question.
Okay, this question is from a Hispanic resident. This is from Carlos Lucu, and he asks, does citizenship status matter in regards to COVID relief and help?
La pregunta es si tener una ciudadanía o estatus legal toma parte o forma parte de poder recibir ayuda del fondo del COVID-19.
I can tell you that citizenship does not matter. Just like citizenship doesn't matter with who get the virus and who doesn't, citizenship will not matter in who will get the resources that will be given out by the city of Plainfield. Please, go ahead.
Les puedo decir que la ciudadanía no importa, como la ciudadanía no importa a quienes agarran el virus o a quien les afecta el virus. La ciudadanía no importa para recibir fondos o ayuda de la organización, y Plainfield hará todo lo posible para ayudar a aquellas personas.
I suspect the question was really asking if undocumented individuals would be entitled or would receive any relief that we intend to give out from this fund. That's what I believe the person was asking. And there are a number of undocumented people in our city, in our nation, who are paying taxes and who are a part of the drivers of the economy. And so even when a person or some individuals are undocumented, they are still participating in the economy in every possible way. They are contributing, and they cannot, and under my watch, they will not be left behind.
Yo creo que también la pregunta estaba básicamente preguntando si las personas indocumentadas pueden y son capaces de recibir fondos para el alivio del COVID-19. La realidad es que muchas de estas personas están pagando impuestos, están ayudando en la economía en todas las maneras posibles, y yo no voy a dejar que estas personas no reciban ayuda, porque ellos son lo que sustentan también la economía.
Let's go to the next question.
Mayor, this is from Ta Ebanks. I have seen a huge spike in the amount of seniors affected in nursing homes. Lots of workers and families then get infected. What is being done to make sure they're not spreading the virus? Is there enough protective gear?
La pregunta es, yo he visto un aumento del virus en hogares de ancianos. La pregunta es qué estamos haciendo por ellos y si les estamos brindando la ayuda necesaria y las cosas necesarias para protegerlos.
I will ask Director Brown and Director Burgess to tackle that question.
Thank you, Mayor. I'll start. So one of the challenges that the state is having is really monitoring and checking in on not health centers, on the nursing homes. As the governor has announced, every nursing home in the state has cases, and they are looking into making sure that there's enough staff to take care, that there's enough PPEs to take care of, that needs to be taken care of. All of that is being looked into because it is a public health issue right now, particularly in nursing homes.
Uno de los desafíos que tienen los estados es revisar los hogares de ancianos. Todos, casi todos, tienen casos y están mirando las personas, el personal, y todo esto está siendo muy visto para poder ayudar a cada caso y a cada persona afectada.
Is there anything you want to add, Director Burgess?
The thing I will add to that is in regards to the residential home, like the Park Hotel. We have been educating them there. Our officers were over there yesterday. We supplied them with masks for the residents. We've also done some education of the staff there in order to help with controlling the virus if it were to infect that particular location, and keeping the residents safe there as well. As far as the nursing homes, I know that our OEM has been in constant contact with our nursing homes.
Let's go to the next question. I'm sorry.
Oh,
Translation, please.
It's okay. El hotel residencial de la Park Avenue también los estamos educando y dándoles mascarillas también al personal, a las personas trabajando ahí, y también a los hogares de ancianos. Yo sé que el OEM también está haciendo todo lo posible que ellos pueden para ayudar.
Go to the next.
Is from a Hispanic resident, Judy Deligna. What is your opinion in regards to opening up business as the president is looking to do?
¿Qué es tu opinión en reabrir los negocios de la forma de lo que el presidente estaba diciendo?
I believe I addressed that in my opening remarks. I know how much the economy is hurting. I think we all know that. We are hurting here in Plainfield, every city across these United States. Every one of our cities is hurting.
Como yo lo había dicho en mis comentarios de apertura, la economía está sufriendo y cada uno de nosotros estamos sufriendo de una manera por la economía.
But what we must be guided by, and I am hoping that our president, our governors across the country would not rush to try to reopen the country at a time when the virus is still so prevalent all across the United States. And we here in Plainfield, we are seeing our number of positives rise on a daily basis. And so we cannot, and I hope that there would be no rush to reopen the country until we have our hands firmly around this virus in a way that would suggest to us that we have passed the worst of this and that we are not in danger of seeing the virus reoccur to the point where we have mass infections that would result in countless loss of lives. So we have to be very careful, we have to be patient, and we cannot rush and should not rush to reopen the country until we are in a position to really make a very informed decision based on health data from our professionals and not on data from politicians.
Lo primero es por lo que debemos guiarnos, y espero que nuestro presidente y también los gobernantes no se van a apresurar a abrir la economía mientras el virus todavía está tan grande. En Plainfield, los casos positivos siguen aumentando día tras día y yo espero que no va a haber ninguna prisa en abrir la economía, en reabrir el país hasta que hemos pasado lo peor de este virus. No queremos arriesgar más vidas y ver que esto pueda resurgir otra vez. Tenemos que ser muy cuidadosos y muy pacientes y tenemos que hacer decisiones bien informadas por médicos y no en base a los políticos.
Let's go to the next question.
Andrea Todman asked, does the city have any plans to make masks available for free or at low cost to residents?
La pregunta es, ¿la ciudad planea dar mascarillas gratis o a un precio muy bajo por los residentes?
Yes, we do. We are concerned about some of the people that we still see walking without masks as they go about their necessary business, and we are concerned about our homeless population. We are concerned in general about anyone who is seen without a mask. And so we intend to make some masks available to those who need them. And we do intend to go from corner to corner and begin a distribution of masks to individuals who are in need. So yes, we do plan to have a mass distribution of face masks.
Sí, estamos preocupados por aquellos que todavía están haciendo sus negocios día tras día y también por nuestra población que no tiene un hogar, que están en las calles, y tenemos la intención de hacer las mascarillas disponibles a todos y ir esquina a esquina para que todos puedan tener mascarillas y todos tengan esa protección.
We're working on that as we speak, and we hope we can begin that kind of a distribution within the next 48 hours or thereabout.
Estamos trabajando en eso ahora mientras hablamos y esperamos que en estos 2 días se pueda distribuir.
Let's go to the next.
La siguiente pregunta.
Cynthia Nunez asks, can we limit services, for example, transportation?
La pregunta es, ¿podemos limitar servicios como la transportación?
Can you repeat? I didn't get the last, for example, what?
For example, with transportation like bus services.
Como transportación como buses o transportación pública.
At our municipal level, we are not able to limit transportation. We don't own any transportation resources beyond the buses that we use for our seniors. Any decision on public transport will come from our governor, and he has already imposed certain restrictions on buses and trains, and I believe that he will continue to look at that closely to see whether or not it's working. But at the municipal level, we don't have any power or authority to impose any transportation restriction more than has already been done from the governor's office.
No podemos limitar el transporte público porque esas medidas y esa autoridad solo lo puede tomar el gobernador. Aún yo sé que el gobernador está tomando medidas para restringir el transporte público y para proteger la vida de cada individuo. Pero otra vez nosotros no somos dueños de la transportación pública ni lo podemos limitar. Eso es decisión del gobernador.
Are there any more questions?
There
Please,
are a
go ahead.
few more, Mayor.
Okay.
Annette Brent asked, do our police have all the protective gear that they need?
La pregunta es si los oficiales y la policía tienen toda la protección que ellos necesitan.
Okay, Director Burgess? You're muted. Okay, on mute.
Me now? Can you hear
Now
me?
you can, yes, now, yes. Continue.
Okay. So the police department, we do have a decent amount of protective equipment at this point. We are still looking for donations as we don't know how long we're going to be in this particular situation. So as you know, we continue to appeal to the community for donations to come in. We really would appreciate that. But for now, we are doing pretty well with our PPE gear.
Sí, la policía sí tiene la protección que ellos necesitan, pero también estamos abiertos a recibir donaciones para reforzar y para que estemos más protegidos, pero sí hay protección.
Let's go to the next.
Okay, 1 second. This question is from Jeff Spellman. Elizabeth is providing UEZ relief for small businesses. Is Plainfield planning something similar for UEZ businesses?
El pueblo de Elizabeth está proveyendo ayuda a los negocios pequeños. La pregunta es si Plainfield está o hará lo mismo.
I'll ask Director Jackson to comment. You need to unmute or you need to speak into the microphone.
Okay, hopefully can you hear me now?
That's better.
Yes.
Okay, Plainfield is rolling out a program to assist small businesses utilizing UEZ funds. We will be taking that program to council for approval on May 13th at the May meeting.
Nosotros estamos asistiendo y estamos trabajando para asistir a los negocios pequeños y hicimos un programa y lo llevaremos a que sea aprobado mayo 13.
So with the approval of the council, the answer is yes.
Y si el consejo dice que sí a este sistema, será un sí.
Next question.
Okay, Beverly Crisp has a concern. She wants to know if we're going to establish a homeless shelter, in particular for inmates that are being released from jail. They are sheltering in abandoned buildings because their families are unwilling to provide them shelter for fear of being infected.
La pregunta es si Plainfield va a establecer refugio para personas sin hogar. Hay personas que han salido de ser encarcelados, pero sus familias no los quieren recibir por causa a la contaminación. La pregunta es si Plainfield va a establecer lugares y casas de refugio.
The city of Plainfield does not have a location where homeless can be housed. And so at this time, that is beyond our capacity to do. There's no housing that the city owns in Plainfield that can be used for such a purpose. I would ask Director Brown to add or to elaborate on that.
Actually, Mayor, thank you for the question. I think that you have answered the question completely. We simply don't have the capacity to manage that right now. I know it is becoming a concern for not just our municipality, but most municipalities that have returning citizens, but we simply have no place for them to go.
Ahorita no hay ubicación para poner un lugar para esas personas que están regresando a nuestra sociedad. Eso está actualmente más allá de nuestra capacidad, aunque sabemos es una preocupación, simplemente ahora no tenemos la capacidad para hacerlo. Para los refugios, para los indigentes.
But if I may, we are working we are working with the county to try to figure this out. So hopefully we may have a solution to this, but it's certainly something that the city and the county are trying to figure out.
Aunque ahora no tenemos los recursos para hacer eso, estamos trabajando con el condado porque es algo que como ciudad y como condado nos preocupa para tener un lugar para las casas de los indigentes.
Let's go to the next question.
So several residents asked this question. They'd like to know if there is a demographic chart or map to know where most of the infected people are.
La pregunta es si hay un mapa o un lugar donde se pueda ver lo demográfico de dónde está el virus.
I'll also ask Director Brown to take that.
Thank you. There is no demographic map to highlight where the COVID-19 cases are. I'm comfortable in saying that it is all of the city of Plainfield. It's in every ward. And that's where we stand right now.
Ahora, actualmente no hay una tabla o una mapa demográfica para saber dónde está en Plainfield, pero sí sé que está en toda la ciudad.
Let's go to the
Deidre
next.
Howard Franzel, sorry, man. Deidre Howard Franzel wants to know if there will be heroes pay for the workers of fire, police, DPW, PMUA.
If there be hero pay, what's the question? Repeat that one more time, please.
That's the question. Will there be heroes pay for the workers of the city, DPW, PMUA, fire, police?
La pregunta es si habrá pago para los héroes como los policías y los bomberos, etcétera.
We, at this time, we don't have any plans or any resources that can be used for that purpose. I can tell you that I wrote a 650-word suggested guest editorial to one of the major news organizations with a suggestion for a first responders Bill of Rights, a GI Bill of Rights for first responders. So look out for that editorial. I am hoping that they pick it up and that the public will get to see the suggestion that I have come up with to provide for our first responders in a way similar to how those who fought in World War II in 1944 when the GI Bill was passed. I have submitted an editorial speaking to that and offering a recommendation to the federal government.
No, en este momento no tenemos los recursos, pero yo escribí un artículo de 600 palabras a una organización de noticias con sugerencias para una declaración de derechos para aquellos que están peleando esta batalla en primeras filas, como los doctores, los enfermeros, etc. Entonces estén en la mirada para este editorial y que podamos hacer una proclamación de derechos para los que están en primeras filas respondiendo a esta crisis.
Let's go to the next question.
This question is from a Hispanic resident, Carlos Luco. He would like to know the phone number for COVID-19 assistance.
Is there going to be a Spanish translation?
Sorry, you cut off. I didn't hear anything.
Oh, I'm sorry. Carlos Luco would like to know the phone number for COVID-19 assistance.
Carlos quiere saber el número para la asistencia del COVID-19.
We have not yet established a phone number. We have not yet established an application form, but we will put those pieces in place and we will communicate that publicly to everyone.
Ahorita todavía aún no hay un número de teléfono al cual ustedes puedan llamar, ni un formulario de solicitud, pero al nomás lo tengamos, se los vamos a comunicar.
Next question, please.
Annette Brent wants to know if we're able to provide any kind of transportation assistance to those who are seeking shelter in Elizabeth.
La pregunta es si vamos a proveer ayuda de transportación a aquellos que acuden refugio también en Elizabeth.
Director Brown, do you have anything on that?
No, I do not, but I will look into it and get back to you. Whatever programs that we can get people into, we're certainly going to try to do that. And however we have to do it, we will figure it out.
Ahora no tenemos una respuesta para eso, pero al nomás lo tengamos, les vamos a decir cualquier manera que podamos ayudar, vamos a ayudar.
Next question, please.
Christian Gonzalez asks, how many times should people go out to get food? Maybe there should be a limit on visits. It makes no sense for people to be hanging around.
La pregunta es cuántas veces debería salir la gente a comprar o buscar comida. No debe ser una forma de uno socializarse.
I agree with that person. However, that all falls under the charge of the governor. And until the governor imposes that kind of restriction limiting the number of trips to the grocery store, there's nothing that we at the municipal level can do about that. It's up to the governor, and his executive order lists grocery stores, food establishments as essential services.
Sin embargo, yo estoy en acuerdo. Sin embargo, ahora eso no está debajo de nuestra autoridad, sino debajo de la autoridad del gobernador. Él no ha dicho nada de eso. Él ha dicho que eso son cosas esenciales. Entonces no podemos hacer algo que el gobernador ha dicho. No podemos hacer algo que el gobernador no ha dicho. Entonces eso todo depende del gobernador.
Mayor, can I add to that?
Please,
I
Director.
would like to say, thank you, sir. I would just like to say to everyone that's listening and information that you can pass on to your families, the more that you go out, the more that you're putting yourself and your families at risk. So if you can limit the times that you're going out for food, going out for medicine, going out for whatever those essential needs are, it's best for yourself, your health, your safety, as well as your family's safety to limit those times, because you don't know what you're encountering when you're in those grocery stores. And I say that to the families who have younger adults or young children. It's the same thing when they're out and you're allowing them to go to the schools where they should not be, but playing ball and things like that. These are things that are bringing more risk to your own family. So I'm appealing to everyone to adhere to the governor's executive order, to stay at home and limit the times that you go out for essential purposes. Thank you. Thank you, sir.
Lo que yo les quiero decir para todos los que están escuchando es que entre ustedes más salgan, más se están poniendo sus familias en riesgo, y aquellos a los que aman, sea por comida o etcétera, deben de acudir a las órdenes del gobernador, y no saben lo que ustedes pueden encontrar en el supermercado. Entonces traten de mantenerse en casa, salir solo cuando es necesario, y porque si uno sale más, eso puede traer más riesgo a ti mismo y a tu familia. Muchas gracias.
We have 10 minutes before we wrap this live chat up. Jen, is there another question?
Yes, Jennifer Popper would like to know how many nursing homes does Plainfield have, and the number of long-term care facilities?
La pregunta es cuántas casas ¿cuántos hogares de ancianos tiene Plainfield o lugares para ayudarlos?
I know of 3, but I'm going to let Director Brown answer that, and we will not name them.
That's correct. There
Director
are
Brown.
three long-term care facilities in Plainfield.
Sí, hay 3 lugares hay 3 casas de ancianos en Plainfield.
Next question, please.
Jose Ayala wanted to know how many residents are currently hospitalized, if we have that number, and are we informed of local hospital capacity constraints or area hospital capacity constraints?
La pregunta es cuántos residentes están en los hospitales y si sabemos la capacidad de cada hospital.
I'll ask the Director Brown to take that.
Sure. Thank you. That's a great question. Unfortunately, we're not told of the hospital capacity. We not given that information. And so, unfortunately, I can't give you a full answer to your question.
Nosotros no sabemos, no conocemos y no nos han dado la capacidad de cada hospital, así que no podemos responder con totalidad esa respuesta.
Although we would love to be able to give you the same level granular details that you might get from the governor in his briefing, we don't have the same information that the governor has.
Aunque nos gustaría darles la información que les da el gobernador y que el gobernador tiene, simplemente nosotros no tenemos esa información.
Next question, please.
Diana Ludabeth asks. Sorry. Do babies need to use masks if they go to the doctor for vaccinations?
La pregunta es si los bebés deben de usar mascarillas si van al doctor por sus inyecciones o medicina.
Well, babies are people too. And I would hope that any parent would make sure that their babies are covered up when exposed to the public. But babies are people too and should be covered up.
Bueno, los bebés también son personas, entonces es muy importante que los papás puedan cubrir y proteger a sus bebés antes de salir.
Next question, please.
Caroline Wellington wants to know if you will share your editorial with the residents of Plainfield. I assume she's referring to your statement in the beginning of the live.
La pregunta es si tú vas a compartir tu editorial de lo que habías escrito con los residentes de Plainfield.
The answer is that news organizations cannot be preempted. If you do, your editorial may never see the light of day through one of those vehicles. And so I will not until I have a firm answer from the organization that I have reached out to. So not at this time.
La respuesta es no, ahora en este tiempo no podré darles eso hasta que el noticiero agarre el artículo y cuando ellos ya lo publiquen, entonces ahí yo les podré decir, pero en este tiempo no lo podré hacer público hasta que ellos lo agarran.
Next question, please.
Okay.
5 more minutes.
Julian Sherry asks, how often will these town halls be held? I find this very informative and an excellent way to communicate to the residents of Plainfield.
La pregunta es, ¿con qué frecuencia se llevará a cabo estos ajuntamientos en línea? Me parece una buena manera de comunicarse con los habitantes de nuestra ciudad.
We intend to continue these weekly conversations with the residents of our great city of Plainfield, and when there is a need for the frequency to change, we will make the appropriate adjustment, either more frequently or less frequently, but we do intend to continue speaking to our residents on a regular basis.
Sí queremos hablar con nuestra comunidad de una manera regular. Queremos hacerlo semanalmente, pero si debemos de cambiar, quizás va a ser más frecuente o menos frecuente, dependiendo a la necesidad y nuestro deber de comunicar con ustedes lo que está sucediendo.
Next question, please. Next question, please.
Robert
there more
Kearney
questions?
asks, there's one more question here. Robert Kearney asks, if conditions continue, is the city prepared to forego a tax sale this year?
Si las condiciones continúan, ¿va a haber unas ventas de impuestos?
The city will always be guided by state statutes, but we will also be guided by the city's needs. And so these are difficult times, yet the city has to provide resources to its residents. We still have to clean the streets, pick up the garbage, and do all of those things that a municipal government is responsible for delivering by way of services to its residents. And so even though these are tough times, the city must still generate revenues in order to have the cash flow to pay its bills and to provide the services. And so we will do only what the state directs us to do in terms of any modification of the things that we do on a daily basis, weekly or monthly, to generate the revenues that we need to keep the city afloat.
La ciudad, primeramente, la ciudad está guiada por los estatus y también por las necesidades de la ciudad. Ahora son tiempos difíciles y tenemos que proveer recursos para nuestros residentes. Aunque sean tiempos muy difíciles, vamos a hacer lo que el Estado, el gobernador nos dice que tenemos de hacer y para que también tengamos y generemos ingresos para nuestra ciudad.
Next question, please.
Jen, that's a Spanish question.
Okay, let's see.
After this, there'll be one more question after this one.
This is from a Hispanic resident, Carlos Lucu. In regards to the quarantine with children in the house, does the city have any ideas on having any activities with police or firefighters going through the streets, saying hello or singing or giving some kind of message to the children, some kind of motivational message?
Ahora de los niños que están en cuarentena.
Can anyone?
Question?
Yes, please.
Okay. In regards to children being in quarantine in the house, will there be any activities that police or firefighters will do to give motivational messages to the children, going through the streets, talking with them, or giving them some kind of message? Kathy, we can't hear
Okay.
you.
You are on mute. For some reason, we can't hear you, Kathleen. All right. Let me try to respond in the absence of the Spanish translation. I will try to respond, unless you're back, Kathleen.
I can translate for her.
Jennifer can read it.
All right, Jen, why don't you translate?
So, en español, teniendo en cuenta la cuarentena y que hay niños en casa, ¿la ciudad tiene alguna idea sobre una actividad con la policía o bomberos pasando por las calles, como saludar, cantar o enviando un mensaje con motivación para que ellos no salgan a la calle?
So I think that's a great question, simply because it is always good when our kids can hear from our bravest and finest. That's always a wonderful thing. But the problem that that poses is that the kids that we want to sing to are supposed to be at home in the house. So I am not sure how we do that. And I don't know that our police officers and firefighters are not doing it to the extent that they can. Any comment on that, Director Burgess? I don't think Director Burgess can hear me.
I know
I
I'm
don't
frozen. I
know.
don't know. Can you hear me still though?
Yes, we can hear you. Go
Yes,
ahead.
we
Speak.
can hear you.
Speak, Director Burgess.
Can you hear?
Yes.
Okay, I actually think that that is an excellent idea. Can you hear me?
Yes, we can hear you.
Okay, it sounds like it's a great idea. I think that the only concern that I have, and I've seen things like this on the news and TV, it brings more people out, and then it's so if we were to come up with something like that, we would have to come up with a creative way to do something. So something, maybe I can reach out to the fire director and maybe we can, think of something together that we could do for the community.
I'll do it if we can.
Did you hear me?
Oh, yes, we heard you loud and clear. Um, we'll take one more question and then I'll wrap up.
Mayor,
Yes, Jazz. Okay, Jazz, are you speaking?
I've exhausted the questions that I have right now. I just
Okay.
I'd like you to remind everyone that the transcript of the live is going to be put on our COVID-19 page on the website.
As well as on PCTV. Is that correct? That this live chat will be on PCTV?
The live chat will be on PCTV. I was saying the written transcription will also be on the COVID-19 page. So
Okay.
if there were any questions that for some reason was overlooked, they can look for their question and see the answer there.
I would like to conclude this live broadcast by asking anyone who knows of individuals or companies that can make a donation to the Plainfield COVID Relief Fund to make checks payable to Plainfield COVID Relief Fund and mail those to the attention of the mayor's office, Plainfield City Hall, 515 Watchung Avenue, Plainfield, New Jersey, 07060. I also would like to take this opportunity to thank all 17 of the clinicians that have volunteered so far to staff our test site once we have it up and running here in Plainfield. I want to thank all of the support staff who are on the phone, who the public can't see, but they're on. If I needed them, we would have been in communication so that I could provide responses to you. But I also want to thank the members of the team that is on this video chat for making yourselves available and for all the work that you do. More importantly, I want to thank all of the residents of Plainfield for understanding the gravity of the situation and for working with us to keep this lid on this very insidious and dangerous virus. And I want to encourage each and every one of you to stay at home. Thank you, and may God bless each and every one of you. I think it's a wrap. Thank you.